Joining us now, Dr. Michael Osterholm, Director of the Center for Infectious Disease Research and Policy at the University of Minnesota. I want to start with a dramatic warning this week from the head of the CDC, Dr. Rochelle Walensky. Here she is.
I'm going to reflect on the recurring feeling I have of impending doom. We have so much to look forward to, so much promise and potential of where we are, and so much reason for hope. But right now, I'm scared.
Doctor, was that an overreaction? How serious is the situation we're in right now with the virus? And how close are we to a fourth wave?
Well, first of all, Dr. Walensky was being a truth teller. What she said is exactly right scientifically, and what we're doing in terms of our response to this virus is, in fact, a major challenge right now. So I congratulate her for her honesty with the public. We are the only country in the world right now experiencing this increasing number of cases due to this variant, and at the same time opening up, not closing down. And the two basically are going to collide. And we are going to see substantially increased number of cases. If I think anyone in Michigan had thought that they would see 8,400 new cases on Saturday like they did, no one would have believed that a month ago.
Well, I want to talk to you about that because we are seeing a 19% increase in cases over 2 weeks ago, and cases are going up in 24 states. Here is President Biden this week.
I'm reiterating my call for every governor, mayor, and local leader to maintain and reinstate the mask mandate. Please, this is not politics. Reinstate the mandate if you let it down.
But, Doctor, the places that we're seeing the biggest spikes right now, you pointed out Michigan, in the Northeast, are not the places that have relaxed mask mandates and relaxed lockdowns the most, states like Texas. So what's the correlation between lockdowns and new cases? Because they don't seem to correlate.
Actually, there's really a very good explanation for this. If you look at the history of this pandemic and start way back last April when we saw a house on fire in New York and other cities around the country, and then follow that from then to Memorial Day when the upper Midwest had a big increase in cases, that dropped, and then the South, basically from Southern California to Georgia, had a big increase in cases in July, 70,000 cases a day. That dropped, and then we saw another big surge of cases in the upper Midwest and the Northeast in that time period around November, where we got to 200,000 cases, and then those numbers dropped. And then the South lit up again from Southern California to Georgia in January, and we got to 300,000 cases. We seem to be in a cycle of regional activity, and right now the upper Midwest is lighting up with the Northeast, and it won't be long before the rest of the country will be following behind.
So are we in a fourth wave right now?
Well, I believe we are, and I believe that in some ways we're almost in a new pandemic. The only good news about this is that the current vaccines are effective against this particular variant B117. But in a sense, this is a virus that is now 50 to 100% more transmissible or infectious than the previous viruses. This is a virus that causes 50 to 60% more severe illnesses. And so what at one time wasn't as much of a problem, for example, in cases in young adults, are now becoming very serious cases. And so that this is really a fourth wave, you might call it, with somewhat of a different picture than we've seen in the past waves of the pandemic.
The 117, B117, that's the UK variant. Just before we came on the air, you were telling me about a spike in cases in schools in Minnesota?
There's a spike in cases all over. Kids, particularly those 8th grade and younger, were not really much of a part of the pandemic that we saw in the past 10 months. Very few cases in terms of transmission. They did not serve as important sources of the virus into the rest of the community. That is completely turned on its head with B117. They are now, as kids, getting infected at the same rate that adults do. They're very effective at transmitting the virus. And right here alone, just in Minnesota, in the last 2 weeks, we've had 749 49 schools with cases. In Michigan, the same thing. Anywhere you look where you see this emerging, you see that kids are playing a huge role in the transmission of this. So all the things that we had planned for about kids in schools with this virus are really no longer applicable. We've got to take a whole new look at this issue.
So where are we now? Are you saying that we need to close schools back down, that we need to put mandate that people wear masks and lock down businesses and restaurants and gyms and all of that? Where are we?
Well, let's just first of all take a look at where the rest of the world is as an instruction to what we need to consider. There isn't a country in the world right now that is seeing a big increase in this B117 that is not locking down. We're the exception. And so the bottom line message from all of these countries is we could not control this virus until we did lock down. Now, I understand the absolute resistance in this country even to consider that. And, you know, it's kind of like trying to drink barbed wire. But the bottom line message is the virus is going to do what it's going to do. And we're going to have to respond somehow. Whether we do accept that if we have large outbreaks in our communities, we're willing to pull back on some of the restrictions that we've loosened up on. Are we going to reconsider schools and school transmission as a new factor here that we didn't have before? Nobody was wrong in trying to get schools reopened. Now we have new data that says this virus is a game changer. So I think we are all going to be looking carefully at what to do, and I think that's exactly what you're getting the messaging right now from people like the director of the CDC.
Yeah, but let me pick up on that, Doctor, because we're getting mixed messaging from the CDC. On Friday, the CDC put up a new travel warning, and it said that people who are fully vaccinated can travel safely within the U.S., but it also warned against non-essential travel. So, frankly, as somebody, I've gotten fully vaccinated, I don't know how to make sense of that. If you're fully vaccinated, is it safe to get on an airplane or not?
You know, and that's a very, very fair critique. We do have a problem right now from a public health messaging standpoint trying to nuance that message. And exactly what you do does put you at increased risk if you're around a lot more virus. So, for example, traveling. If you're fully vaccinated, you have a lot of protection from that vaccine. But it's not perfect. It's not 100%. So if you want to reduce your risk from even getting infected with the kind of exposure you might have in the community where the virus level is much higher right now, then avoid it if it's non-essential. But we have to do a better job of helping the public understand this is short term. All we're trying to do is get through this surge of cases that are going to occur over the next 6 to 8 to 10 weeks because of this B117 variant. The future looks very bright this next summer if, in fact, we can keep people from getting there. Chris, nobody wants to be the person to die 3 days before they were supposed to get their COVID shot. That's what we're trying to avoid right now.
Dr. Osterholm, I wish it were a brighter picture, but thank you for this great talk. Thanks for coming in. Good to talk with you, sir.
Thank you, Chris.